Hi, my name is Dr. Raja Adnan Ahmed and I'm a psychiatrist and I work in UK. I'm making this video for the international psychiatrists who are going for the ST training interviews in the UK. Now remember, this is specifically for the ST training interview. I'm making this video in the January of 2024. The interviews are end of January 2024 to February 2024 and the jobs are starting in August of 2024. This is not for the non-training jobs. If you are watching this video and you want to know how the non-training job interview is done, so I've done a series of videos on the YouTube where you can find the commonly asked questions which are used in a non-training job interview, and you can sort of use them and practice them on those bases. Just this one is specifically for the ST training job interviews, which is a very specific format and it does not apply to a non-training job interview. So I've made a little presentation, a few slides, and I'll take you through them and we will discuss how the interview is conducted, what to expect, what sort of questions to be will be asked from you and the time frame you will have and how to tackle those questions. Let us start this presentation and I'll take you through some of the slides if I make things a little bit easier so you can have some visual prompts as well rather than just watching me talk. So this is for the ST training interviews and my name is Dr. Raja Adnan Ahmed. And now the next slide we'll go to. So learning objective from this presentation or this video is that I can explain the process of interview to you, how the marking of the interview is done, and how those marks are counted in your overall score for the ST training when you're applying. Then we will discuss the interview questions, and I'm using the interview questions which have been used in the past 2 years and the past 4 rounds. If they change the interview, then I will have to take this video down and talk you through the new interview questions. But as for now, I understand, and we're assuming that the questions will remain the same. So we'll discuss the question which has come in the last 2 years, and they were the same. And then we will also talk about some of the themes which are associated with those questions and what are they trying to ask you, what sort of answers they're expecting, or what sort of things they are looking for when you're going through these interview questions. I'm doing this in particularly for the international medical graduates because they sometimes find it difficult to answer these questions as they have not, especially the ones who have not worked in UK. You know, it might be completely new for them that what sort of answers are required from this interview. So this is the slide just explaining some of the application scoring system that when you actually apply for ST training in psychiatry, it's not just the interview, there are some other things they consider. So number one thing is to look at the CAS score. So CAS score is the most important thing. So they will that will form the 50 half of the marks, which you will get. Then the verified self-assessment score. These are the achievements you have done so far when you're applying for the job in ST training. They will ask you to submit some self-verified score, that what sort of achievement you've done, research, audits, experience to teach and all of that. So a lot of people will, worry about that part because they say that I've applied for ST training, but I don't have research or I don't have any additional qualifications or I haven't done an audit or I haven't done a quality improvement activity. So will I be marked down? So you will not get as many marks as the person who has done those things. But if you look at the overall marks, the verified assessment score or your portfolio score is only 17%. Most of the marks are from the CASC and from the online interview. So obviously CASC exam, you have to do well to get good marks. And then you can practice for the interview and do the interview well to get good marks so your application can rank higher. So the marks are written here. The maximum score is 200 and you get marks out of 200 from that. So this is the score of the interview itself. So there's a total score which is out of 200, where you are your CAS score is counted, your self-assessment score is counted, and this is specifically for the interview. So interview is actually marked out of 50. So there are 2 questions or 2 situations the examiners will give you. There will be 2 examiners in front of you, and they will be independently marking you. So out of first case, there will be a STEM question. Then you start answering them and they can ask you some supplementary questions. Depending on your responses, they will give you marks out of 10. So example, 5 out of 10, 6 out of 10, 7 out of 10. So independently, both examiners will score you separately. This slides tell you the interview process, which a lot of people get confused about. So the interview, by this time, if you're going for interview, you would know this is online interview. The first thing that happens is that you will be given a link. You enter the link. It's like a Zoom meeting or Teams meeting. Similar thing as if you have done online class, that was a similar thing that you sort of get a link and you enter the room, virtual room. Then will be ID check. And then after you ID check, you will be in front of the examiners. Introduction, sometimes they do a brief introduction of who they are. The total thing actually takes, people have told me, it doesn't take more than 20 minutes, 25. And it's not that long. Then two questions, they will be six minutes for you to answer. To give answer, you can see that 6 minutes is a very small amount of time. It's less than what you were used to in CASC. Then there will be some supplementary question. I've written sub question, which means that there will be a supplementary question within the original stamp. So they won't ask you something out of a blue, out of a place. They will ask you something from the stamp in itself, depending on how you're answering. The one thing to remember, now some of the international medical graduates, when they saw these stamps, they thought it's like CASC because they're talking about a patient. So maybe they would be actor in front of them. Maybe they will be explaining something to the actor. So there is no actor here. So to remember, there is just examiner sitting in front of you who are consultant psychiatrists, and they will ask you the question, and you have to ask in theory, basically speak to them. So you don't have to take history from anybody. And this, as I said, it goes very fast. So that's why they give you the questions in advance, and you have to practice them. You need to have an idea of what you're going to say, because you cannot make up things at the spot. That would be harder for you to do. So this is the case as an example I'm sharing you, which has been coming in the past at least 2 years, as far as I can remember. The same case, the same thing for the interview has been there. If they change it for this year, that will be a different thing. If they give you new cases, and then I might have to make another video to explain what is expected. But for now, if you assume that this is the case which has been coming in for the past 2 years. So this is the part A, which is the first case for you. You will have 6 minutes to answer this. But if you read that, it's about you've just taken over care of a patient and you are meeting her for the first time. The patient says that she's unhappy with the care given to her and she does not agree with the management plan. You've been informed the patient's care is complex and her relative and team involved in the case has not agreed for the best way forwards in the past. Assume that she has capacity, then how will you approach this situation? Now, as I said, as far as I've been told by the past candidates that although this is 6 minutes, 6 minutes will start when you start answering. Sometimes the 6 minutes start when you're reading or the examiner is reading the question. But then you will have first minute, maybe 90 seconds, maximum of 2 minutes to answer in a free way. And then they will start to ask you some supplementary questions. The supplementary questions will not be from outside. They will be related to the case, related to what you are talking about. So what you need to do is think about the case of how will you approach this, what themes can you see in here, and how will you formulate your answer. And this sort of case will be given to you at least a week in advance. So you practice it well. Practice first in your head. Practice, in front of a camera yourself, record yourself, and do that. Then practice with your friends who are psychiatrists, or practice with your seniors. So the themes, if you look at this particular case, we can say that it's about management of a complex case. They're trying to see that how will you approach a complex case. It's about information gathering, because as they said that you are new to the team, but the case is not new. The case is known to the team. So how do you gather information about this case? How will you inform yourself that what is said, what has been going on? Then it's about communication skills. Obviously, communication skills are very common and very useful in any psychiatric cases. But in this particular case, it's very, very important because the patient and the family are not happy with you or the service. And then it's about management of that complexity, that how will you hold this in a consultation, and how will you approach it? What can you say to her? How will you gain their confidence? All of those things are important in understanding this sort of case, and that can help you to formulate your answer. So the next one, which again has been coming for the past 2 years as far as I can remember. 6 minutes again, and again the same thing. Your time will start. You will have 90 seconds or 2 minutes to speak freely, and then they can ask you some supplementary question. Now, in this one, they're not talking about patient, but they're talking about team. So this is about teamwork and management and all that. So you have just begun your ST4 training in a mental health trust. The hospital you work is in extremely busy and psychiatric teams understaffed. You have seen some poor example of teamwork in patient care as a result. How might this affect your work, and what will you do in response to this? So you can see that they are trying to figure out that how will you deal with a chaotic team or a complex team or a team which is not functioning well, and how do you see yourself in that situation? How will you deal with that situation? Again, there are certain themes that will come out of this. You need to work on those themes, make an answer, practice it first with yourself, then with the senior. The themes, just give you some idea, those sort of themes we're talking about here. Patient safety obviously is one important theme, that if a team is not working well, ultimately we all work for hospitals and our center of attention is the patient. So if it's a chaotic team, is that affecting the patient safety? It's about teamwork, the management, how to lead a team, what sort of issues could be in the team and how can you overcome them. Then it's a calling to improvement activity as well, opportunity, that if you have gone to a place where things are not working well, maybe it is a time or chance for you to improve the services. Then it's about your training needs as well, because at the end of the day, you are a trainee, and if it's a place where you're not getting enough training opportunities, what sort of things you can do to improve that. So these are some of the themes that can come out of this question, and I'm not saying that you have to cover all the themes. Yeah, it's just to give you an idea. Every individual doctor will answer this in their own way, from their own experience and from their own style. So I think that is it. I'll just go to the marking system again. So again, as I said, case 1, case 2, 2 consultants in both, same consultants, they will both do the both cases. They will score you out of 10 for each cases, and then the way you communicate, that's a separate marks for that. So total marks of 50. In total, their marks will be gathered, and you will get something out of 50, 30 out of 50, 40 out of 50, something like that, a score. And that score will then be adjusted for your total score, which will include your CASC and your self-assessment score. So there is also a RCPsych website which have a lot of information about the ST training interview. I think they have done a video there as well. So if you want to have more information about how it can go, you can go and watch that as well. But from my side is thank you very much for listening to me, and I'd like to wish you all the best. And I hope you will be able to do the well interview, and you will be able to secure your own job where you like to work. I normally do a live session for this as well. I hope to arrange that by the end of January when I find a weekend. And I hope, and during that live session, we can do some practice one-to-one with the candidates. The candidates can get a feel of how it is going. So thank you very much for listening, and I hope you all well.